introduce themselves so Dr. Poor knows who she's talking to. How about Eric, you want to start?
Hi, Dr. Poor. I'm Eric Olson.
And what organization are you with?
I actually am not representing any organization other than the fellow disabled here in the community.
Okay, great.
Hi, Audie. My name is Jen Pollock. I am representing Millard Public Schools. I work in special education for the district. I also work with Project Extra Mile. We actually sat next to each other at the dinner in November. So good to see you again.
Good seeing you.
And I'm Nancy Floral, and I'm with the Nebraska Commission for the Blind and Visually Impaired. We're the state agency that provides vocational rehabilitation services to blind, visually impaired, and deafblind.
Welcome.
I'm Megan Walls. I am representing kind of the broader disability community. I work, my company is Assistology. I work as a consultant and training resource around inclusion, accessibility, and assistive technology.
Dr. Poor, I'm the person who has been emailing you from the city. I'm Catherine Baker-Colema. I'm the assistant to the director and assistant director of Human Rights and Relations.
Great.
And I am GMKUHN, assistant director of Human Rights and Relations for the city of Omaha. Also liaison with CAP on the Mayor's Commission with Citizens for Disabilities. Thank you so much for joining us this meeting, Dr. Poor.
I'm Stephanie Scavdahl. I work for Outlook Nebraska. We employ and provide enrichment activities for those that are blind and visually impaired.
And Taryn, you want to, you're muted, unfortunately.
Taryn had mentioned that she had emailed her microphone wasn't working, so she was going to have to chat. So.
And I see Taryn represents long-term care facilities. She works at Brookstone Village, is associated with QLI. So that's who is joining you today, Dr. Poor.
Okay. Okay, well, thanks for having me and reaching out. You are always representing constituents that I'm not sure we are reaching out and enough. However, when I checked with my staff before I came in this meeting, they actually have, we have a list of 95 organizations, and we are using this list to send information out. And we send out at the beginning of this outbreak our health alert network that was put together by us and the state, as well as CDC information, but probably have not done a good job to update any of that information. So let me just share with you that in the beginning and why I'm interested to have you and to talk to you today. As you have heard, let me just give you a quick update from the global perspective. We now have more than 351,000 cases globally. Of those, 15,300 deaths. The US is now the country that is with the third largest amount of cases, behind China and Italy. And that's probably not where we want to be. And when I looked at this data at 8 o'clock this morning, I'm sure it has changed a lot since then. We had more than 35,240 cases in the US and 473 deaths. And when you look at the US, we really see the area with the highest death is New York City. That's the #1, and it's followed then by King County, Washington state. And you probably have heard what is happening in those communities. Then when we go a little bit closer locally, what we see in Nebraska is we are around more than 50 cases in the state of Nebraska. However, we have at least 35 cases of those 50 are in Douglas County. What we have been seeing over the last few days, I would say, is that rural Nebraska is seeing cases too. We have seen quite a few cases in North Platte, 2 cases in Lincoln, two cases in, I think, Knox County, 3 or 4 cases in Sarpy County. So what we are seeing is it's not only, it was first really concentrated in Omaha, as you can expect, but it now is spreading out in the community statewide. What we have seen when we are looking at our cases is that more than half, about 2/3 of them, are due to travel. Individuals who traveled, first it was to international travel, but then it was to communities where they see high outbreaks. For example, we saw a lot of several individuals who came back from Seattle and tested COVID-19 positive. Now we are seeing several individuals who are coming out of New York City. Florida is now on that list to California. And what happens is, just so that you are a little bit aware of it, when those cases are being reported from laboratory to us, and this happens usually, now it depends on what laboratory it goes to, usually happens in the early afternoon, but it can happen till night. Our disease investigators are really, I would say, trained to do a good history with those individuals. So they call them up and they ask them, where have you been in the last 14 days? Because that is so important for us to know. Where have they had close contact with? And you hear the word close contact a lot. That really means somebody has been less than 6 foot away from each other and they have spent more than 10 minutes together. Not just walking by somebody and thinking, oh, I could have been infected. Just some background on, well, let me go on with that. So then when those contacts investigations identify certain contacts that this individual has had, most likely household contacts, they will be informed that they have to really quarantine themselves for 14 days because now they have been in contact with somebody that is positive for COVID-19. But let's say they also worked in a setting where they probably shared an office space together. So we also would contact the individual who has worked with them and say, you have been exposed to an individual with COVID-19, you should quarantine yourself at home. So from those, the first case that we had, I'll never will forget, the individual, and you have heard very openly, they have been very open about this, had traveled from England, from Great Britain, and came back to this country. Didn't have any symptoms. The person had some respiratory symptoms anyway, but didn't have anything. Nobody was thinking of COVID-19. The individual was actually a little bit disabled. So they had gone to the Special Olympics in Fremont. They had placed at the basketball tournament there. They had gone to the ER 3 times for other things. They had a fever, they thought they had a concussion from the basketball game. Never did it occur to the healthcare provider to ask the individual, could it be that you have COVID-19? Until the individual went back again and had real difficulty breathing in an ED in the evening, and a COVID-19 test was done. The individual was positive, which meant that all the healthcare providers that had seen this individual now needed to go into quarantine, which was an absolute disaster for healthcare because we need every healthcare worker. But that has happened, unfortunately. That quarantine is over, and I'm really happy to say we were able to circumvent that so that not one single individual came down with COVID-19 besides the father and the brother of the individual. Those two did. And they isolated themselves immediately, isolated themselves immediately. And the father was the one who wrote this nice article in the Omaha World Herald, apologizing to the world, so to say, that this happened, which of course he couldn't do anything about it. The second one was a traveler too. What was interesting, a travel to California, came back, but she was in a household with 13 other household members. And so what happened pretty quickly, 6 of those household members came back positive. But so what you are seeing is it started with a traveler and then went to the household. And from then on, we have an entire group who who flew to New York City and came back. And there are now, I think, 3 or 4 of them who are positive. So most of them are very related to travel. There were 2 who said to us, you know, I just was informed, I visited a friend, the friend just called me and said they were positive, I probably should get myself tested. And long and behold, they were positive too. So that was a contact to a positive. Then we had the first case where we really could not identify what the source of exposure was. First, we thought it was travel related, but then when you do those investigations, usually you don't just hang up after a half-hour phone discussion. You call them again the next day. You ask again, do you remember something else? And the next day, the person said, you know, I do remember these symptoms that I'm talking about. I really had them before I went on my trip. As a matter of fact, during the trip, they became better. This individual only went to see a healthcare provider when she returned because she had a surgery scheduled and she wanted to make sure that she could have the surgery. So the physician did what all physicians do now, did an influenza test on the individual. She was negative. And then they do what is called a respiratory panel. They want to see, is there any other respiratory disease that these individuals have? Because the symptoms are so similar. She didn't have flu, she didn't have respiratory virus, so they did a COVID-19 on her and she was positive. That was the first community. The second community acquired incident was an individual who is working in the construction industry. He hadn't traveled, they hadn't contacted, he was working on the construction site with only 3 individuals, none of them were positive. Actually, he joked to us, he says, you know, I don't go grocery shopping, I don't go to a church, I don't go visit friends, I have no friends over to my house, I'm really kind of a recluse, so to say. He has a girlfriend and that person is getting tested. So at that time, we had to assume, or we have to assume, that potentially the virus is in the community and somebody just touching an object and then putting it in their face could actually infect themselves. So the second case then precipitated an order under direct health measures. And that's the authority that the health department director has to say, these measures are necessary so that we do not have a greater infection in a community. And so I put that in place last Tuesday. I amended it because we had the second case. I amended it on Friday. Also in between Tuesday and Friday, the governor, through the chief health medical officer at HHS, provided the same order for Douglas, Washington, Sarpy, and Cass County. And the order is very, not simple, I would say, but pretty straightforward, I think. It's not what the community thinks, but I think, and it really talks about public gatherings. Talks about that public gatherings should not include more than 10 people. I amended it on Friday to be in conjunction with the governor's order, who said not more than 10 patrons, customers, or other invitees, including staff. No, not including, excluding staff. Okay, so what it means is 10 people in a room. However, if you have staff there, for example, in a daycare, it lays it out for a daycare, actually more specific. There could be 10 children there and plus staff. So that went into effect, and it also specifies a little bit more who does this order include. It talks about schools, of course, gymnasiums, salons, fitness centers, auditoriums, stadiums, arenas, large event conference rooms, meeting halls, theaters, libraries, or any other confined indoor or outdoor spaces. It then goes on to talk about liquor, beer, and wine sales, and they are restricted to carry-out sales, delivery only, to the extent permitted by law. It also talks about restaurants, and the same goes for restaurant, bars, taverns, private clubs, and any dine-in establishment. They are restricted to carry-outs, delivery, drive-throughs. It does not apply to any food service in healthcare facilities. So that's kind of where we are at this time with this order. And we are getting a lot of questions. Well, this doesn't affect me. I'm not in this order. It is not about cutting or slicing a piece of the pie. It's about having social distance. That's really what it's all about. This virus is very, very small. It's 1/900th of a hair. And I always say it hitches a ride on your sputum, on the particles that you, when you talk, that you expire. But those particles usually do not fly out in the air and go 10 meters. They go around 3 to 6 feet. You hear some different arguments by different experts. So that's why the 6 feet distance is so important. If we really want to stop this virus, that's what we need to do. I can tell you some of the symptoms, some people have very mild symptoms, but what we are also seeing is now we are starting to look at the data, because when the data is really just a handful, it doesn't give you a good indication. But what we are starting to be able to do now is, who are the people that are mostly affected by it? And at this time, from the data that we have, it is 20 to 40-year-olds. That might be a testing bias, because we are testing only high-risk groups, and the high-risk groups did include travelers. So we may say, you know, you are not only testing those, and once we open up the testing as it's happening now, because these private laboratories are coming on board, I think we are going to see a wider spread. But up to this time, I have to say, I'm really happy that it seems we are protecting the high-risk group, the elderly, those with underlying illnesses, and immune-compromised systems. What else could, so let me just, so that epidemiology, that's one function of the health department. We also pretty early, because we had learned from Ebola that the public really is hungry for information and looks to a credible source. So we have opened an information line. In the beginning of the information line was more about general information. Well, what is coronavirus? What do I need to do? What can I prevent? The questions are now becoming much more difficult. They are much more geared to, you know, my healthcare provider won't test me. Where can I go? Where can I find PPE? Do I need to follow this order? So we have 10 lines and 3 Spanish lines at this time. And we get up on a high day, can be up to 350 calls from the morning 8 o'clock to 4:30 in the afternoon. 8:30 in the morning to 4 o'clock in the afternoon. After 4 o'clock, the line goes over to 211 and individuals can call 211 for information. We see that line is not being used as heavy as this. About last week or 10 days ago, we got a shipment from the national stockpile, the SNS. And the shipment comes from the state national stockpile, and it contained mainly PPE. And by that we mean N95 masks, regular surgical masks, gowns, and face shields. And that comes to us, to the health department, because we are the hub for this region. We then allocated, and it's already allocated by population. We allocated out to Sarpy County and to Washington County. Our portion then, most of it goes to the Healthcare Coalition, which is in Omaha, which is a coalition with all the local health department, not local health department, all the local healthcare providers in the community, because most of this PPE is really meant for healthcare providers. That's what we hear nationwide. And if those individuals do not have appropriate PPE, they will not want to come to work and will have a shortage of healthcare workers that we need so desperately. So there is also in that health coalition, we have emergency medical services there too. So they receive some of the surgical masks, especially EMS, who transports some of these individuals to hospital systems. That's about, and then, you know, the other proportion is, of course, that we do like to communicate with the community as a whole. We have started, and you have seen over the last probably 10 days or so on, to really use an individual with sign language to make sure that our messages go out to the population that need to hear. We still need to do a better job, I realize fully. And so, you know, you may have some advice today how to do that and how you can play a part in getting this information out to the people that you serve. So I think I'm going to stop at that and see what questions you have from me.
Thank you, Dr. Poor. Really appreciate it. I'm sure folks do have a few questions. I'm gonna take the advantage to start us out. I know that there are questions that folks have about testing, especially folks that might be immune compromised or have significant disabilities. Can you shed light on what the status is in terms of the availability of tests coming in to the metro area?
Yeah, it's a very good question. So we have 2 laboratories at Nebraska Medicine. We have the Nebraska Public Health Lab, which is a state-funded laboratory. They have very strict criteria who they test, and it is the elderly, it is individuals with underlying illness and immunocompromised. What needs to happen with those tests is that individuals need to need to call their healthcare provider, and then the healthcare provider needs to provide and think, yes, this individual is qualified or really needs to be tested because they have symptoms too. We talk about respiratory symptoms. We are not, and I think the healthcare providers are very hesitant to test at this time individuals who do not have symptoms. So respiratory symptoms, cough, fever, temperature above 100.4, shortness of breath. Specifically, we see that many of these individuals that really need to be tested are those with shortness of breath. We see that as something very serious. They potentially need to be hospitalized. So that's that process. Then at the same time, and they can actually do about 130 tests a day. at Nebraska Public Health Lab. At the same time, Nebraska Medicine has developed their own test. So that test at this time is really mainly for individuals who have a healthcare provider that goes through Nebraska Medicine. And if that healthcare provider thinks, yeah, I would like to have this individual tested, then that can go forward that way. At the same time now, we have ARAP, LabCorp, Quest. Those are probably the three major ones that have come on board, where healthcare providers now don't need to follow that criteria, that very strict criteria, but can actually propose that their patients get tested. The drawback is that testing could take, to get the results back, it could take 5 days. So, you know, that those are a little bit the drawback. You may have heard that there is a company, actually 2 of them together, who wanted to open up a drive-through testing site. It was a little bit misleading because they only had potentially I think 200 tests, and we just, the mayor was very concerned that this actually is going to be more a safety hazard, and that they made a little bit wrong promises to the public compared to what they actually were able to deliver. So she pulled the permit, rightfully so, because on the permit, it never indicated that they were going to provide COVID testing. But I'm saying that because, as you have seen in other communities, these drive-through testing sites, they are going to happen in Nebraska. There is, especially Bryan Hospital in Lincoln is one of it that probably has it worked out pretty closely. And I think you are seeing other hospitals that are going to come on board. When that is happening, I think more testing, more positives. But you know, testing is not a panacea. You may be tested today and be negative. And you think, okay, I'm safe. I'm now, let's say you are somebody who works in the EMS system, and you now go and you transport and carry. We would need to test you again in a week because you could have had another exposure. Or it was early in the exposure, the viral load in your system wasn't high enough for a test to pick it up. So it's not black and white. And that's, I think, what people sometimes do not understand. And we are seeing and are starting to see physicians who are making clinical diagnosis and say, you have this risk factor, you have these symptoms, and you have traveled to New York in the last 14 days. We don't even need to test. You potentially have COVID-19. Stay and self-isolate yourself at home. Then we don't hear about it, we don't know the numbers, and we never really can say how widespread it is. You will also therefore see, you know, in the beginning when we were able to really confine this, we were able to say, if you were at a Walmart from 3 to 5 on 50th and L or wherever the address was, you could have been exposed to somebody in that store. That doesn't mean that the person walked through that store, but it probably means the person worked at that store. We cannot really release through HIPAA. We need to be very careful what we release about the person. But pretty soon, you are not going to see me releasing public spaces anymore because it's everywhere. And it's a false sense of security that I think if we give, when we give lists of these events.
Okay. Jennifer, you had a question for Dr. Poor? You're on mute.
Yeah, my question is, are we confident in that 14-day incubation period? I've heard combinations of 14 days up to 21 days.
You know, that's a good question. So the average is what we say is 5.3 days. We feel pretty confident with 2 to 14 days. But what that does not mean, it does not mean that you are not able to shed virus after 14 days. It just means that potentially shedding doesn't mean it's a virulent virus. So we are saying 2 to 14 days at this time because most likely 99% that is the time.
Thank you.
Mm-hmm.
Others?
I just wanted to clarify, when you were talking about the kind of the processes and the locations where testing is happening. So there's 2 labs down at the Med Center that the healthcare provide that are done for individuals whose healthcare provider is within the UNMC system, if I'm hearing it right. And then there's the Nebraska Public Health Lab. Are there other sites? And at those sites, is that where individuals whose healthcare providers are through Methodist or like the concierge medicine, that those are the sites that those individuals would go to?
Correct. You will go to your primary healthcare provider. Let's say your primary healthcare provider is at Methodist. Methodist now, we have just received 2 tests from them. They go to ARAP. They are using a commercial lab to send their specimens to. So does CHI. We now are hearing that Nebraska Medicine is potentially going to make their laboratory available also to some other local healthcare system. But you go to your healthcare provider.
Thank you.
Okay, Gerald, you had wanted to make a comment or a question?
Yes, Dr. Poor, in the city of Omaha and Douglas County and Sarpy County, we have a lot of individuals who are in congregate settings, whose immune system does not allow them to either get out and go get tested if something happens, or they're physically unable to. It would cause more damage to try to move them to go get tested. So my question is, if something like COVID-19 virus enters a congregate setting where you have a lot of people who are immune compromised or disabled, what would the health department's steps be, or how could we quarantine in a group setting?
So let's say you are in a congregate setting and you would have an individual that is COVID-19 positive. It really would behoove that center or that setting to have an isolation room where the individual could be placed, and also have a quarantine room. And we see those are the things that we are now talking to the shelters about, that they really need to have some room to quarantine individuals, or potentially even isolate those who do not need to be in a hospital setting. I mean, each of the hospitals has rooms for this, but you know, they are going to be overwhelmed with those who really need hospitalization. So the community is looking at potentially a hotel or a motel or so on. But we think it is more appropriate that each of the organizations is trying to work through what their pandemic planning is, because this is very similar to any type of pandemic we could talk about, and see that they have some setup, or who is their medical provider, who are they using as medical provider, kind of work with them. This really needs to be worked out.
It really sounds like there's a strong emphasis on the distancing component, Dr. Poor. Am I correct in that?
Say that again,
It
please.
sounds like there's really an emphasis on the social distancing.
Very much so.
Okay.
Social distancing and hand washing. I can't tell you how many times today I've washed my hands. But social distancing, you see tapes when you walk around, and don't walk around. But if you will come to our health department, I have actually walked around with a meter, and I said 6 feet. It's very uncomfortable. We are not used to that. You know, we like to hug and be close to people. But the social distancing, that is what is going to end the spread.
Okay, thank you. Laura, you had a question?
I do. Can you hear me?
Yep.
Yeah.
Okay. I have been seeing some what I believe to be really false information, things like the nursing homes have the virus. They're spreading in their nursing homes. They're not telling people and letting people die. I know that not to be true. How can we stop that false fear?
You know, actually, I'm very proud of the nursing home. I think nursing homes saw what is happening and what happened in Washington State, and it scared a lot of people. So I'm very proud, and I probably shouldn't say it too loud or knock on wood or so on. Our nursing homes have taken the proper precaution that they have prohibited visitors quite a few days ago, actually. I probably would say even it may have been more than a week ago, and are now taking other measures by screening their staff or so on. So when you hear these things, and often, you know, you hear them on social media, they may not be directly related to the community. There are so much rumors going around. We could do just rumor control the entire day. I mean, you know, I had a rumor today, somebody went to Nebraska Medicine, they didn't have a ventilator, and therefore they just let the person die. I called back to Nebraska Medicine. I said, what about this? Absolutely no true. We have 30 people on ventilators. We have 70 more ventilators out there. So that's how I try to really be sure. If you hear those rumors, I think do what you can and say, you know, that's not true in Omaha, Nebraska. So it's really not true in Nebraska as a whole. And also, I do think, you know, anybody who lives in a nursing home and knows how those nursing homes are run knows that there are much more compassionate people there.
Thank you, Dr. Poor. One of our attendees has microphone problems. She asked, are you aware of any COVID-19 deaths in some of the younger age groups? And she asked a second question. If you'd like, I'll wait on that until you answer the first.
You know, we don't. We hear, I think there is 1 or 2 cases now worldwide, actually, up to, I think the youngest one may be 9 years of age. But honestly, in the last few days, I have been so involved in this that I probably haven't been able to keep up. But we hear of very few deaths. So let me say something else. We hear very few deaths, but when I look at the data, we see that still a lot of the younger individuals are carrying the virus, and we are concerned that you carrying the younger teens or so on carrying the virus could give the virus to an older high-risk individual. And that's why we are saying stay home for everyone. Don't go to the beach, and some of you may have seen those pictures.
The second part of her question, thank you. Also, should home health residents with symptoms go to the hospital or self-isolate at home? She asks because home health aides do not have full access to protective equipment.
Should home health agencies or
home health?
I mean, home health is doing a lot with video conferencing now. And I would say that's probably where they should go. I understand the PPE and that they probably do not have the PPE. So I would encourage the more, I know the VNA is using that technology quite a bit, and I would recommend most individuals, or you are screening the person that you go to by phone and say, do you have symptoms? And then not go to that individual with symptoms, but have them home quarantine, and if necessary, then have them call their healthcare provider and say, you know, I have these symptoms. Do you think I need to go to the hospital or not?
Okay, sound good, Rachel? Okay, great, thank you. Others?
Yes, I have a question, Dr. Poor. You mentioned earlier that the gentleman who contracted the COVID-19 in the second community transmitted case, he didn't go out, he wasn't, you said recluse. So how likely is it for someone to go into a grocery store or what else is still open? People's jobs or a professional place of business and be infected with the virus, touch something, and can that, or sneeze on something, can that virus live on that surface and someone be affected that way?
Yep. Good question. So there are some studies in regards to the virus living on surfaces, and it really depends on what the surface is. But we now know the virus can live on surfaces at least 2 hours, but up to 2 days. So that's how individuals get infected, actually, by touching a doorknob or a desk where somebody before has coughed on, and you are now putting your hand in your face, and they are talking about the T line in your face, and that is your eyes, your nose, and your mouth. And how many of us, and I'm looking at you all here, none of you have their hands in their face, but I can't tell you how often I say to staff, take your hand out of your face. We are so accustomed to have our hands in our face. So yes, that can happen. And in a grocery store, I would say, and you heard now the recommendation, for example, that you don't bring your store bags into your store and into the store again, but you actually are getting a bag from the store, because this movement in and out of the store. Also, when you bring groceries home, that you really are careful on the outside of what you have there. Be careful about the bag. And then again, hand washing, hand washing, hand washing. So that's, I'm concerned. I'm concerned about my staff walking around, touching something. One, being at the beginning state of the disease, not really realizing that they are coughing up virus. Everybody touching that same surface, because that's how they get out of the door. And we have community acquired in the health department.
Can I just add a clarifying, when you talk about the grocery stores, I've seen recommendations, and I think this is what you were referring to, but that people disinfect and wipe down their groceries when they bring them in the house. Is that something that you would recommend for containered items?
I would, because I think we need to be so careful now at this time, and the more careful, and how much does it take for us to wipe those things down? Yes, I would recommend them. There is recommendation out there too, and you can go on the internet and see about how to wash fresh fruits and vegetables, because everybody has their hands in there. Just be much more cautious now than you ever were before.
Other questions? Good job, Steph.
Good. I may get some of my time back this afternoon.
Well, actually, I had a question, Dr. Poor. One of the things I know that is really concerning folks is how far down the road may some of these things go. And you may not be able to answer that, but a lot of folks are really working very hard with the restrictions or the requirements or the recommendations, however you want to frame it. But can you, from your perspective professionally, is there a way to even estimate how long we might be in this circumstance?
Yeah, it's a good question that I got asked a lot. We always see these outbreaks. Potentially 8 weeks, could be 12 weeks. But what's the good news is out of China, really, where the outbreak, if we can trust the data, the outbreak started before the end of the year. And what they have seen now in the last week, and I haven't looked at it today and yesterday, they have seen actually 0 cases. So it means their very strict movement inhibitions, they have worked. And so when you look at that, you would say, well, that's about 2.5 months. But they were very strict, and they are still strict, but they are releasing some of those restrictions now. You know, they have these housing units. It's a little bit like we have gated communities, so to say. So now they are loosening up within those gated communities that at least people kind of can walk around. They cannot leave the gated communities yet. So why I'm saying that is that it depends on how good we are in keeping these behaviors, as so to say. You know, as I said before, we have seen now eight states, I think, who have complete restriction on movement at this time. That's not the case yet in Nebraska, but I do think we need to be prepared for it. We have not seen the peak of it in Nebraska. I would be lying. I mean, we see cases, and I think we'll see cases increasing all the time. So we made the order through the end of April because we thought that was a reasonable time. I would foresee that potentially in the middle of April, the beginning of April, we are starting to review it, talk to our infectious disease docs who really live in this space a lot, look at the data, what it looks like, and see, do we need to become stricter, or before we become, or can we actually relax some of the restrictions? But at this time, I don't foresee any loosening up of the restrictions.
Thank you.
Okay, if that is it, I wish you all a good day. And if you want me back in a month or so, please feel free. I'd be more than happy to have a discussion and provide you an update.
Thank you, Doctor.
Okay, thank you. Have a good day.
Thank you.
Okay.
Thank you. Mark, you're muted.
Mark,
Sorry, I'm here.
muted.
I muted, then unmuted, then muted again. You timed not touching your face really well for when Dr. Poor was taking a look. I don't know if we were all being that fastidious, but I guess at this point in time, Kat has sent out some resource information. There's quite a bit of it. I don't know if we want to just bring our own questions or comments or resources to bear in terms of our discussion. I thought the things that folks submitted was excellent. Where are we headed to from here? And there's somebody in the chat.
Well, I just wanted to add, I know one of the questions was about student and family access to like behavior, mental health supports in this time. We've been given, as school districts, federal guidance from OSERS, and I'd be happy to send out that letter. The really short answer is this is obviously not a reason or excuse not to provide services to families and provide that free, appropriate public education to kids. Every district then has, you know, those bumpers to live within in terms of service delivery and what that looks like. I've spent my entire spring break and today working with teams to figure out, for all the unique needs that kids bring in to the table every single day, how we're going to provide those services and access to those things. So I'm really proud at kind of the infrastructure we've built to provide access to families, regardless of what they may or may not have in the home in terms of distant learning kinds of things, computers, technology, that kind of stuff. So,
did you provide that particular resource to Kat, Jennifer?
I haven't yet. I will send that. I was just going to reply it to the email that everybody was on, if that's okay. Otherwise, I can certainly give it to Kat as I think she's on that one, so I'll make sure.
If you sent that to me, that would be awesome. Or you could send it to the reply all. I did add a mental health section.
Good. Okay.
In the resources.
Yeah.
There's the Boys Town National Health Line, the National Suicide Prevention Line, the Women's Crisis Line, the Nebraska Family Health Line, Iowa Family Health Line, and the Substance Abuse and Mental Health Services Administration. So there are various options in there.
Perfect.
Yes.
I know one of the pieces that a lot of questions are coming, and let's see, I'm unmuted, good. Has to do with children learning at home, and especially like in early intervention and their access to different services. There is really good guidance from the Federal Department of Education on that, which I supplied to Kat.
Yeah, that's what Mark, I think we're talking about the same thing. That's what
on the same page? Okay.
Yeah.
Yeah. Well, this was less focused on behavioral health and more focused on services. So I think we just crossed streams there.
Yeah.
But,
yeah.
No, it was excellent. And I mean, the requirement for a free appropriate public education didn't end just because of, this circumstance. So.
Yep.
Others, what do you got? Show
what is the process, or how are we going to get all of this information that we've learned and that we're gathering out to the people that we're trying to collect it for?
Outstanding question. I can tell you one thing that is on my list, and that is I met with the Nebraska Consortium for Citizens with Disabilities this morning. And they are very, very interested in what we're doing. And they're putting together, that group is putting together a list, and they, their goal, at least in terms of our discussion this morning, was to be able to link to not only our discussion with Dr. Poor today and our discussion amongst ourselves, but then also the whatever list we put together. And I commented, that it was resources that were, going to be primarily specific to Omaha, but irrespective of that, they felt like that would be an excellent addition to what they want to put together statewide. So that's one direction to go, because that includes about 20 different disability agencies. But I think there needs to be some intentionality in terms of how we get the word out to ensure that the people who have the questions are getting access to the information. Absolutely. And I'm open to what are our next steps. I mean, we can all work within our own kind of spheres to ensure that, for example, folks get the Facebook link and the YouTube link to this particular discussion. I thought Dr. Poor did a typically terrific job. But I'm really open to how else do we want to get it to folks across the board, big D disability across the board. Thoughts, comments?
Well, I was planning on, at least for the resources, so if you are on the Human Rights and Relations page, there's a little tab for the MCCD. And I was just planning on adding a COVID-19 resources thing for sure. Once we have this list, I would like to add that. So I was planning on doing that this week. So it would just be like a little link that we could send people to make it really nice and easy for everyone.
Can we also post that link in the description of this video when it's posted and on the MCCD Facebook page?
Yes.
And then we can just be sharing it in multiple ways.
Yeah, absolutely. I figured just having one basic link would make it easier for people to share.
This is Laura. We are in the process of calling all of our consumers weekly. And the links that you sent out earlier today, Catherine, I shared with my staff and have asked them to share with their consumers during their weekly call.
Okay.
So that's how we're trying to help get the word out. We're in a lot closer contact than we typically are in helping to stop the fears, stop the spread, and making sure everybody that we're responsible for are taken care of.
So I'm hoping that this document will look a little bit more organized and pretty. I wanted to get something put together that everyone could look at for the meeting. And it'll be more organized and everything. So we'll have something that looks nice that we can send out to people. And something that we can continue to add on to as people send in more resources.
I'm also wondering if we can kind of do this in reverse. You know, Jennifer mentioned things. Well, I'm not sure. It's hard to keep track who mentions what, but on a call like this, but we talked about like the Boys Town helpline and other 211. Dr. Poor mentioned 211. I'm wondering if we can develop a list of information providing services that we can, you know, just make sure that they're aware of this link so that folks that are either calling in or are coming in online, whatever the case, can access it.
You know, as I'm sitting here just listening to the commission, I'm wondering on a day like today, and we had such a powerful, got so much information from Dr. Poor, I'm wondering if it would behoove this commission to create a listserv that we could get out to those individuals and those organizations that we need to.
Well, that was my thought. It would be a matter of kind of, we could do the same thing we did with the resources and just say, one of our tasks for this week is to forward, you know, it comes to mind right away that like the Aging and Disability Resource Center, folks across the state, 211, at least within the realm of work that I'm in. I'm sure there are others related to education, special education, physical disabilities. For example, the SILT comes to mind immediately as a potential resource, the ARC of Nebraska, or the Alley Web Center as the local ARC. I think we could put a list together pretty quickly. What do you guys think of that as a task for the group?
I think it's a good idea. I was going to also add, you know, the state has the hotline for disabilities. If we share it with them, if people are calling in with questions, they would have it there too.
Is that thumbs up from the group, or of course I can't tell from Laura, but Taryn.
Yes, that sounds good.
Okay. Okay, well, are you good for you, Kat?
Yeah, you know I'm cool. I'll do what's good for the group. I'll make it work.
Okay. Other points of conversation, anything related to the information that came in, or if you had a chance to take a look at it to this point?
I've skimmed it. I haven't dug into it deeply yet. I do wonder, what about the newspaper or local news even? We're making a lot of assumptions that people have internet access and things like that to get a lot of this information too. Could we utilize some of those other free resources as well?
Well, this would be a question for Geraldine. Would we have access to the loss of words. The city public relations, in terms of trying to get some of this out. Would that be a good fit, Gerald, do you think?
I think so. I'd have to double check with Dr. Thompson. I think that he's still on the call.
No, he left.
Okay.
He was on, but I think he's off now.
Okay. Well, when you say public relations, what do you mean? What do you mean?
Well, to access, things like the World Herald and get a note out to the television stations, in terms of some of the things that are going on with the news and just information sharing with the public, that this is available for the folks that we're representing. Just to get.
I think we can definitely do a press release, and of that nature, and do I have to ask Carrie down in the mayor's office who we would contact and the best plan of attack. Once we get a product together, whether that's like a listserv or however we plan to disseminate information, we get that together. The best we can do is ask, right?
Well, we have a head start on a resource list that.
Yeah.
So I think we have a product. The other product is just the presentation by Dr. Poor. I think would be something we'd want to direct people to as well. So.
Well, I think that that information that she gave out today has been consistent with the information that she has been giving at every press conference as well.
Mm-hmm.
I don't want to go ahead. I don't want to have a lot of redundancy in the going on.
I think that she gave some more specifics that probably I haven't heard as a part of a press conference that people might find valuable.
And we could always link this video on the resources page on the MCCD website. So that is always an option.
Yeah, it's less a matter of kind of pushing that out there as much as it is saying, if you want more information, Dr. Adi Poor, Director of Douglas County Health, gave a 45-minute presentation to the Mayor's Commission, and it's available right here. So I'm not thinking about putting it out there in terms of it being redundant, but just as one more resource. And it's, again, for us as commissioners, to just try and support the work of public health officials as it relates to people with disabilities. So
I agree.
Yeah.
And I think for whether it's the press release and or the resource guide, another place, if someone's taking notes, hopefully, but to send it over would be to get it to Radio Talking Books, so that their volunteer readers can read it out. And they also do kind of PSAs during different parts of their programming. So for the individuals that are utilizing that service, they could get it that way.
And I actually have Radio Talking Books on my resource list because they are still functioning during all of this.
Right.
So
I know that Radio Talking Book is doing their update on resources every Friday. I just talked to Jane over there today, just because of the resource list Outlook is publishing on our page, and getting stuff over to her before Friday so that she can make sure that is aired.
So that all sounds really good. So at this point, it sounds like we have some things we want to do. We made some decisions. What are we leaving out, guys? And Megan is shaking her head. I don't know if that's like, oh gosh, or if we don't have anything.
Trying to think. We covered a lot.
Right. I'm sorry to pull your leg. It's just in my nature. What can I say? Actually, I want to thank Megan to the group for her help in kind of doing some thinking through on putting this together for today. So I really appreciate it, Megan. So thumbs up from Megan. Are we good for today? I don't want to just take time. If we feel like we've gone as far as we can go, we can always pick it up and run with it over email if something comes up, if there's a change, or if somebody comes up with just a rock solid, incredible idea on directions to go from here. But I think we have a lot, and that would be my hope walking out of today, is that the commission has stepped up in terms of supporting the work of the city at this time, given this is a real change, guys. There's no doubt about it. Any other comments, thoughts, questions, criticisms about our programming?
This is Laura. My last thought is we'll just try to get as much of this information out to our consumers as possible.
I think that's a good comment, Laura. I kind of brushed past it, but we all have our own listservs, our own links. As I commented, the Nebraska Consortium will be has a website presence, as well as a Facebook presence, as well as, you know, reaching when we talk about IBD, reaching literally every provider of services in the state and all advocacy groups, et cetera. And as much as we can, so we're depending on you, Kat, to kind of let us know what you have and when we can start sending that out.
I can put this, the resource list on the letterhead that we had developed, kind of that we were using for the letters that we were sending to the mayor. So it kind of has our logo and everything, our contact information. So people know where it's coming from. And if everyone could look through the resource list maybe tonight or tomorrow by like noon and let me know if there are anything else that we could add to it. We can maybe have it done by Wednesday to send out. That would be a goal.
Sounds
maybe.
Great. And I can take, the thought occurs, we should probably thank Dr. Poor for taking time out of her, what has to be an incredibly busy schedule. But being on campus, I can get to her, and I would be happy to pass on our thanks from the group. Fair enough?
Thank you for doing that.
Yeah, we have a campus-wide phone book, so I know I can get to her. But I'll thank her on behalf of the group, of course.
Yes,
And
please
our city reps. Sorry?
Please do.
You bet, Eric. So, okay, with that, I think I'll entertain a motion to adjourn, since I didn't entertain one to begin, but.
So moved.
Second.
Okay. Thank you guys for taking the time, for your hard work, for everything you do. This is a tough time. I'm hoping that as we go along, we're going to get more guidance and a little bit more certainty about, especially as it relates to the pandemic and people with disabilities. There are just so many concerns. It's overwhelming. So please, everybody, be safe, stay healthy, practice social distancing, wash your hands, don't touch your face, and I'll leave it at that. What else can I say? You're probably not going to hear me say that very many times. So
Thanks, everybody.
Might want to mark the date down. Anyway, thank you again.
Thank
We'll
you.
be in touch.
Thank you.
Special thanks to Kat and Gerald for their support on this.
Pat and
Exactly.
Gerald,
Thanks,
thank
everybody.
you.
Thanks, everybody.
Bye.
Thanks, guys.
Bye, everybody.
Take care, guys.